Ever wondered how crucial the accuracy of a medical diagnostic test is? Medical tests play a pivotal role in diagnosing diseases, yet they're not always perfect. An incorrect result can have substantial implications affecting both patient care and health outcomes. This brings us to two key statistical measures that help assess a test's accuracy: sensitivity and specificity. Sensitivity in medical testing is a fundamental concept. Put simply, sensitivity is the proportion of people with a disease who test positive for it. It's an indicator of how well a test catches true positives, those who indeed have the disease. A high sensitivity means that the test is excellent at correctly identifying those with the disease, providing a high true positive rate. Consequently, it leaves a slim chance for false negatives, cases where the disease is present but missed by the test. So high sensitivity means that the test is good at catching true cases of the disease. Now, let's move on to the other pillar of test accuracy: specificity. Specificity is the proportion of people without the disease who test negative for it. This is a critical factor in medical testing, as a high specificity means that the test is good at avoiding false positives. In other words, if a test has high specificity, it's proficient at confirming the absence of a disease. An abundance of true negatives and a scarcity of false positives is the ideal scenario. Thus, high specificity indicates that the test is effective at confirming the absence of the disease. How about we illustrate these concepts with an example? Let's imagine a group of 600 people. 100 of these people have a disease while 500 do not. Now, we conduct a test. Among those with the disease, the test correctly identifies 90 of them. These are our true positives. The remaining 10 are false negatives. So, the sensitivity, or the proportion of actual positives correctly identified, is 90%. On the other hand, among those without the disease, let's say the test correctly identifies 450 as disease-free. These are our true negatives. The remaining 50 are false positives, giving us a specificity, or the proportion of actual negatives correctly identified, of 90%. As you can see, understanding sensitivity and specificity is key to interpreting medical test results. So why do sensitivity and specificity matter? They are vital in assessing the reliability of medical tests and guiding their appropriate use. They help us distinguish between true cases and false alarms. Remember, a good medical diagnostic test balances sensitivity and specificity, catching true cases while avoiding false alarms. Thanks for watching.